What is diabetes? Diabetes is a frequent urination with or without glucose. Diabetes happens once your body is not ready to take up sugar glucose into its cells and use it for energy. This leads to a build from further sugar in your blood. Poorly controlled polygenic disease will result in serious consequences, inflicting harm to a good variety of your body's organs and tissues, as well as your heart, kidneys, eyes and nerves. Diabetes facts from WHO. The number of people with diabetes rose from 108 million in 1980 to 422 million in 2014. Prevalence has been rising more rapidly in low and middle-income countries than in high-income countries. Diabetes is a major cause of blindness, kidney failure, heart attacks, stroke and lower limb amputation. Between 2000 and 2016, there was a 5% increase in premature mortality from diabetes. In 2019, diabetes was the 9th leading cause of death with an estimated 1.5 million deaths directly caused by diabetes. A healthy diet, regular physical activity, maintaining a normal body weight and avoiding tobacco use are ways to prevent or delay the onset of type 2 diabetes. Diabetes can be treated and its consequences avoided or delayed with diet, physical activity, medication and regular screening and treatment for complications. Types of diabetes. There are two types of diabetes, namely diabetes mellitus, diabetes insipidus. The mellitus diabetes is also categorized into two: primary, secondary. The primary also grouped into insulin-dependent and non-insulin-dependent. 1. Insulin-dependent diabetes mellitus, IDDM. It is also known as type 1 diabetes or juvenile diabetes. It can occur at any age, but it is most common diagnosed from infancy to the late 30s. With this type of diabetes, a person's pancreas produces no insulin. People who manage their diabetes can live a healthy life. If you receive a diagnosis of type 1 diabetes, your body can't make its own insulin. You'll need to take insulin to help your body use the sugar in your blood. You can also help to keep blood sugar level in a healthy range with proper diet and exercise. 2. Non-insulin dependent diabetes mellitus, NIDDM. It also known as type 2 diabetes or adult onset. It accounts for approximately 85% of all diabetic and can occur at any age. It is most common between 40 years to 80 years. In type 2 diabetes, there is a resistance of the body cells to the action of insulin. Obesity is the most commonly associated clinical feature. Signs and symptoms of diabetes. We have 3 cardinal signs and symptoms of diabetes mellitus: polyuria, it is the frequent urination; polydipsia, drinking a lot of water; increased thirst; polyphagia, taking in more food; extreme hunger; others are weight loss; slow healing of wounds; overweight; obesity; family history; blurred vision; bed wetting in children who previously didn't wet the bed during the night; fatigue and weakness, and many more. Before diabetes is diagnosed, there is a period where blood sugar levels are high but not high enough to be diagnosed as diabetes. This is known as It's estimated that up to 70% of people with prediabetes go on to develop type 2 diabetes. Ways to prevent diabetes. Eating foods high in refined carbs and sugar increased blood sugar and insulin levels, which may lead to diabetes over time. Avoiding these foods may help reduce your risk. Performing physical activity on a regular basis can increase insulin secretion and sensitivity, which may help prevent the progression from prediabetes to diabetes. Drinking water instead of others' beverages may help control blood sugar and insulin levels, thereby reducing the risk of diabetes. Carrying exercise weight, particularly in the abdominal area, increase the likelihood of developing diabetes. Losing weight may significantly reduce the risk of diabetes. Smoking is strongly linked to the risk of diabetes, especially in heavy smokers. Quitting has been shown to reduce this risk over time. Avoiding sedentary behaviors like excessive sitting has been shown to reduce your risk of getting diabetes. NB, eating the right foods and adopting other lifestyle behaviors that promote healthy blood sugar and insulin levels will give you the best chance to avoiding diabetes. Some key words and it functions. 1. Insulin. It reduces excess glucose to normal in the bloodstream. 2. Glucose. It is a main source of energy for the cells that make up muscles and other tissues. Diabetes is a chronic disease that affects millions of people worldwide. Uncontrolled cases can cause blindness, kidney failure, heart disease and other serious conditions. So let's all protect ourselves from getting this chronic disease. Thank you.